I have seen in my 30-year career a huge shift in what I do and what I take care of. I'm seeing a lot less asthma exacerbations. I haven't, knock on wood, admitted a child to the hospital for asthma, and I can't even remember the last time. Ear infections. I haven't done a spinal tap in probably 15 years. Certainly haven't had a positive spinal tap. Meaning, actually, I can't say 15 years. It's been 12 years. My oldest patient who had bacterial meningitis. And so things have changed, and we now have time. I have way more time to ask kids about how things are going in school and how things are going socially. There's a lot more awareness of what's going on for kids socially. Social media. You can't have a talk about your health anything without talking about social media. We had the pandemic with these kids missing out on a few years of critical social development in middle school and in high school. So yeah, George, I think it's always been there, but I do think that it's a combination of us recognizing it, having more interest and ability to address it. And also, I think things are worse for kids. I think they are.
What kind of cases do you guys?
So I just want to ask you one question before you go there. I think also what has changed, pediatrics has changed over the last 30 years, but also the pharmacology of psychiatry has changed. So if you trained before 1990, there were no SSRIs. And the idea of putting somebody on tricyclics was very dangerous. And the family practitioner, the internal medicine doctor, the pediatrician is like, yeah, they need medicine. They need a psychiatrist because these tricyclics are very dangerous drugs. And then we got the SSRIs, and that was a game changer.
Yeah, I remember when I was a kid growing up in Fall River, Massachusetts, I played street hockey. I coughed every day for months.
Yeah.
Right? I was that kid. I was coughing at nighttime. I coughed whenever I played hockey. I coughed whenever it got cold. Every cold I got went to my chest, but I didn't have asthma. Right? But if I were my patient now, I would definitely have been on some inhaled corticosteroid or smart therapy. So yeah, there are a lot more kids being prescribed these medications because we now have the tools.
Yeah, that's been
allergic rhinitis when you started your practice. Not very many, because hydroxyzine was an awful drug to put a kid on every day.
Yeah. There was in-between drug that it was before loratadine that made people gain weight. And as soon as Claritin came out, it went out of the market because it did stop your runny nose, but you gain a bunch of weight. So it's changed a lot, and it allows us to do things better.
Right. That's the thing when you start looking at these statistics, I would challenge anyone, if you want to look at the rise in the number of diagnoses for depression and anxiety, it's bet that the graph and the rise in the diagnosis of allergic rhinitis in primary care has been exactly the same, because non-sedating antihistamines and SSRIs that were about the same amount of time, totally unrelated, but I think it's always been there. I certainly know that all three of us went to school with kids who nowadays would be diagnosed with ADHD or with anxiety or with depression, who didn't get help and struggled and maybe would have had an easier time of it.
And allergic rhinitis, allergic conjunctivitis. I wheezed every cold. My mother had
hard.
But yeah, you didn't go to the doctor. Are you kidding me? And she had bootlegged Bactrim in the pantry. Yeah. It was made by Roche, and it was white. And every time you cough, she would shake it, and she'd give you 2 days of antibiotics for nothing. And that's the way the mothers did.
We had the snow to get to the Bactrim, right? You walk uphill both ways.
We're from Columbia, so she would go every 2 years. We'd go to Columbia for a couple of weeks, and she had this pediatrician that saw me when I was born, and he would check you out. She was making sure everything was okay, that the American doctors didn't miss it. And he would give her a dose for Bactrim and Donatal. And she would bring 3 bottles of Bactrim and a bottle of Donatal. She didn't kill me, luckily, with the Donatal, but it was another world.